Good afternoon, everyone. Thank you for joining us this afternoon. I'm Payal Patani, staff for Fort Bend Community Prevention Coalition. We are a program of Fort Bend Regional Council on Substance Abuse. Thank you for joining us on our third town hall meeting, and I will let Lauren Beckwick introduce our speakers.
Dr. Tonya Martin is a licensed psychologist at Fort Bend County Behavioral Health Services, where she conducts forensic evaluations for the county criminal and juvenile courts, including competency to stand trial, sanity, violence risk assessment, fitness to proceed, lack of responsibility, and juvenile waiver evaluations. She earned her doctorate of psychology degree in clinical forensic psychology from the Chicago School of Professional Psychology, Chicago campus, and her Bachelor's of Science and Art degrees in Psychology and Criminology at the University of Florida. Dr. Martin also currently does contract work with the Adolescent Center and Mental Health Services, a private practice in Houston, where she conducts psychological evaluations and therapy with children, adolescents, and adults, most of whom are involved in DFPS. Dr. Martin is dedicated to increasing her professional competence through research and continuing education and to providing quality care for her clients. Please welcome Dr. Martin.
Hello, thank you so much for having me today. Today I am going to speak a little bit, of course, very closely related to what the other speakers have talked about. I'm going to be talking about the mental health conditions that we're seeing an increase in due to COVID-19. I do have a PowerPoint that I will share, so let me go ahead and share my screen. Okay, so hopefully everyone can see that. So today I'm going to be talking primarily about the increasing anxiety that we're seeing as a result of COVID-19. So Dr. Schell and Dr. Conlon talked a lot about anxiety that we're seeing and how exactly to cope with that anxiety. So why are we seeing such an increase exactly? And so in addition to possibly contracting the virus yourself or knowing someone, if you have a family member who might be at a higher risk than you, there's no end date to this particular pandemic. We don't know when exactly it will end. We don't know how long it will last. And so that can lead to a lot of people feeling like they have a lack of control where the pandemic is concerned. Also, our schedules are disrupted. I think probably for most of us, this might be the first time that we're seeing entire school districts go virtual. And that can disrupt not only the child's daily kind of activity and daily schedule, but also their parents who have to make sure that they're on the Zoom when they're supposed to be, and make sure that they're actually paying attention to it when they're supposed to be. And so our schedules, no matter what your schedule looked like beforehand, has been disrupted quite a bit. We're also teleworking a lot, and we're experiencing Zoom fatigue, which is a very, very real thing. When Dr. Schell was talking about how important it is that we get up and move around, now some of us are glued to our computer even more than we were before. And so it's very, very important to still still be active and get outside and to kind of get away from your computer screen so much. A lot of people are also experiencing financial instability. And so, of course, we've heard of the many, many people who have either lost jobs or they've gone or have been placed on furlough. And so that financial stability that they once had has now been shaken. And of course, we also are seeing the grieving in various ways, which I'm going to talk about in a little bit, just how COVID-19 has led to a different conceptualization of grief. So when we talk about anxiety and depression, in particular children and adolescents, and so the other speakers did talk quite a bit, of course, about anxiety and about depression. So of course, we know that anxiety is the fear, worry, or dread that can impair one's ability to function, and it's really disproportionate to the person's circumstances. So when we talk about children in particular, some signs of anxiety in preschool age can be some regression in development. So perhaps some bedwetting. For middle childhood, we see some complaints of stomach aches, maybe avoiding activities that they once enjoyed. And then for adolescents, we can see more irritability, more lack of focus, distractibility, and hypervigilance. Now, of course, we know that some adolescents in general can just be, a lot of adolescents in general can be kind of irritable, kind of lack focus. But really, we're looking at, there an increase in these kind of behaviors. And then also we are seeing, we can see some depression in some children and adolescents where it relates to COVID-19. And it's important to recognize that depression as compared to, or in contrast to, general sadness, is that depression really creeps into all aspects of a child and an adolescent's life. So it really creeps into, their sleep, their appetite, their ability to socialize, or just their propensity really to socialize with others. Depression also doesn't always have a trigger. So sometimes when you ask a child or adolescents, why do you think, or what is making you sad? Sometimes it's hard for them to really identify that, and they can't really pinpoint one thing, and that can be common. We see a lot of disrupted eating and sleeping patterns. Sometimes they'll have little or no joy. It can, of course, be hereditary, and we'll see sometimes some self-blaming, some low self-worth, self-harming, and also suicidal ideation are, of course, more severe symptoms of depression. So these are just some general signs of anxiety and depression, just to kind of look for, especially as parents are now home, and families are now home more together. If you're thinking that maybe COVID-19 is impacting your child in some form or fashion in a negative way, these are just some general signs and symptoms to look for. So I mentioned just briefly on another slide about grief. So COVID-19 has really been kind of described as a time of collective sorrow, which Sherry Cormier, who is a psychologist, and she specializes in grief and grief mentoring, that's what she has kind of described COVID-19, because in some form or fashion, everyone has lost something. So when we talk about the simpler type of grief, we've lost kind of the way our social connections usually look. So, if you are someone who is constantly kind of going either to places with your friends or with your family, out to eat, if you have date night regularly with your spouse, significant other, that has had to look very different in the last few months. There's also this loss of feeling of community, increased feelings of isolation, that loss of financial security that I spoke about too. And also, even if you don't really feel those few things, sometimes, just watching the various systems that we depend on kind of destabilize. And so, a lot of us probably before the pandemic have really seen things like our job, where we live, kind of those things are very, very stable. And now we've seen that COVID-19 has come along and really destabilized that for some people. And so even if it hasn't happened to you, you're really watching individuals and various systems destabilize. And then not knowing when or if we'll return to normal, or what will be the new normal. And that definitely can kind of lead to and increase those symptoms of anxiety that I mentioned before as well. And these losses and changes can really affect our sense of predictability, our control, our sense of justice, and the belief that we can protect our children and elderly loved ones. And of course, these are among the losses that can be addressed by mental health professionals. And so these are really a lot of things, like I was saying before, that we probably have seen or have interpreted as very stable in our lives. And that really has been shaken recently. And so what we see is that COVID-19 kind of experiencing is almost kind of like we're grieving a living loss. So it's one that keeps going and going. You know, we don't know when exactly COVID-19 will be over, so to speak. And so we're constantly kind of thinking about where are we in that process, and when is the end going to be, when is the end of that going to be near? And then we have, of course, more complex grief. So unfortunately, say losing a loved one to COVID-19. And so the grieving process can really be different. We have this added layer of where you have to have physical distance during crucial moments when closeness is really needed. And so examples would be, you know, if your loved one unfortunately does get COVID-19, they're in the hospital, the first thing you want to do is rush to the hospital. But unfortunately, we don't have, we're not able to do that. Funeral and memorial services, you know, unfortunately look very, very different. And that's whether you've lost a person to COVID-19 or not. You know, just because of maintaining physical or social distancing, those processes have to look very, very different. And so that can really also add another layer of depression and sadness to a situation that is already very difficult for individuals. So what we see now is this kind of COVID-related grief. And that's, you know, of course, like I said, the loss of the social connections, loss of all of these different things that people are feeling as we go through this pandemic. And so really the nature of a person's attachments can really have an effect on their reaction to the grief. And so, of course, we as individuals, we can have attachments not just to humans, we can have attachments to places, to projects, our possessions, our professions as well. And the pandemic has really forced us to confront the frailty of those attachments. And so it has really shaken the sense of self of a lot of people. And so, you know, our clients or individuals in the community really can experience grief over anything that feels like a loss of identity. So what we know is that the research shows that losing a job really triggers a period of prolonged grief that is distinct from anxiety or depression. And what the research, or why the research thinks that is because of the self-esteem that individuals feel when they are or feel to that particular job. So the self-esteem that they experience. So it can look different than anxiety and depression. So exactly how to cope with COVID-related grief. And so one thing that some of the grief research says is, you know, understanding that grief is natural and that most people are resilient. And so this particular research study, you know, really shows or really kind of gives the suggestion to really think about grief and really think about it in a really not realistic, but just kind of bringing it to terms and saying, this is not the way the world is anymore, and I need to adapt. And really understanding that it's okay to feel grief over what we're losing, and that it's natural, and that it's okay if we feel the grief over what we're losing. And I really like this particular research because it's more strength-based. It really kind of pulls on kind of talking about that your grief is natural, and really kind of assuring the person that what they're going through is okay. Keeping a journal. Dr. Shell talked about this during her talk, and this is a good technique for both adolescents and for adults. Keeping a journal is very good in terms of grief as well, because it really helps the person to put words to their losses. A lot of times when we experience some type of loss, it's very easy to get caught up in kind of a haze, kind of non-conformed blob of what we feel. And so when we kind of have this journal, we're really putting our words to the losses, then that can really help us to kind of describe how we're feeling and really help us to get through it as well. And really being detailed in what you're losing and how you can work through that. And of course, social connections are still very, very important. So some general tips for self-care. I won't go into too much detail since I know the other panelists have talked quite a bit about it. But, taking care of your basic needs, eating well, staying hydrated, sleeping, exercising, all those things that Dr. Shell gave some amazing tips about. Engaging activities to help manage stress, keeping your daily routine, and taking self-compassion breaks. So, recognizing that you might be having a difficult time and you're just going to take a break and be kind to yourself in that moment. And so those are some general tips for self-care there. 5 ways, just some simple ways to help children with anxiety specific to coronavirus as well. Jennifer Cohen Harper is an author and educator, and she really works to support children and teens through different resources like yoga and mindfulness. And so I really like this because these are some really quick, helpful tips. Manage your own nervous system, or, in terms of like self-care and things like that. Be honest with the child, but don't be an alarmist. So give the particular information, but also communicating to the child that, as number 4 says, reassure them that the grown-ups are on it. Teach kids what they can do. So helping them kind of feel a sense of control, and then also reducing anxiety with exercise and fresh air. So when we talk about, just the self-care or kind of managing that nervous system, that again goes back to that self-care for yourself. So breathing deeply, taking breaks, turning off the television. A lot of the times TV can really inundate us with information about, of course, COVID-19. And of course, it's good information to know, but sometimes it's just helpful just to kind of disconnect and step away from that. Contacting supportive friends and family, because when you take care of yourself, then you're better able to help our children and adolescents. So taking care of yourself, managing your own nervous system is very important. And then you're able to really help to calmly assure the child, helping them maybe list things that have not changed in their life. So this is one way that they can kind of feel that control, or kind of have some type of control that they've lost. Normalize the anxiety for them, and then really communicate that information to them in a calm manner. 3 things that you can do also is to establish, plan, and practice. So establish a routine and really be proactive in keeping that routine. In our department in behavioral health services, we've been talking quite a bit, during staff meetings about how we're managing everything going on with COVID-19. And one thing for me is that it's really been helping me. I have to be proactive and be serious about my sleep schedule, and also my exercise and activity. I've noticed that, getting consistently 7 to 8 hours of sleep every night, as Dr. Shell said, she's absolutely right. It's something that is absolutely needed for our general wellness, especially in a time like now. So really being proactive about keeping your routine and keeping and especially an outdoor activity schedule, getting out there into the sun, into the fresh air. Also planning a schedule of activities for the week. And of course, letting the child help you plan so that they could really be involved in that. Practicing calming techniques, so providing a comfortable place for the child, and encouraging movement and sensory activities. So one of the last things that I wanted to talk about is just how to find happiness during the pandemic. This was actually a research study that we put out, our department, Behavioral Health Services, put out for the county via Human Resources. And it's this research by Dr. Barbara Lee Fredrickson, who is the head of the Positive Emotions and Psychophysiology Lab at UNC. She did a recent study where she surveyed 600 Americans, asked about their daily activities, and that was correlated with the degree to which they experienced positive or negative emotions. And so what the results were, and the results are not going to be that shocking, I'll have to give you the heads up. But the results are that, when individuals who said that in the previous 24 hours when they did the following, they were more likely to report negative emotions. So passively scrolling on social media, interacting with people purely through chat or text. Whereas individuals who communicated more positive emotions in the last 24 hours, they were more likely to report the following type of activities. Exercise, self-care, engaging in spiritual activities, interacting with people, but via video or face-to-face interactions, and going out of their way to help other people. So again, these things are they're not groundbreaking, they're not earth-shattering, but the thing is that some people still have trouble implementing those things. And so how is it that in COVID-19 that we can kind of implement these things? Of course, with additional mental health services if needed. And one way to do that, to help us engage in the second type and not the first, might be just a simple difference in wordplay. So thinking about it as less so of a social distancing and more physical distancing and social solidarity. So, just because we have to be apart from one another doesn't mean that our social connection needs to also dwindle. So kind of taking the time to still meet with your friends and your family members at the same, time or in the week that you usually do. I have a coworker that does Zoom family meetings, I think every Sunday, because they used to see each other very consistently before the pandemic. And so they still do that. And so that's definitely one way to kind of maintain that social connection with others. These are just some helpful resources that I wanted to list on here for everyone. I think some of these are things that Dr. Shell and Dr. Conlon might have mentioned. The Calm app is an amazing app. There is a free version. I use it as well. I actually use it every night to play a sleep story as I fall asleep. And it's an amazing, and some of these other ones, Insight Timer, she also mentioned, is really good. These are just some general references and links. And that is my contact information in case anyone wants to reach out or has any questions or anything like that. So with that, I will turn it back over to the coalition.